Hi to everyone joining. We'll just give it another minute or two just to give everyone a chance to log in.
Afternoon, everybody. Just give it a couple more seconds and then we'll get started. Right, okie dokie. Let's get started then. So good afternoon, everybody, and welcome to the Winter Tracheostomy webinar. This is a presentation on winter health. So next slide, please. Just a quick disclaimer before we go on. So this presentation is a corporate presentation from Atos Medical Group. Nothing in this presentation provides any diagnosis, clinical advice, indication guide, warranty or guarantee. Nothing in this presentation can substitute individual advice or guidance from a qualified healthcare professional. We recommend you must see your clinician or a qualified caregiver for advice on your condition and on products that may be appropriate for you. Thank you. Next slide, please. So, what are we going to cover in today's session? Well, we're going to look at some of the techniques that's going to help you to maintain good lung and pulmonary health in the winter. We're going to look at some of the ways for you to care for your stoma during winter and to look at good skincare advice in cold weather, and also talk a bit about when to access your GP and what to talk to them about. Also, at the end of this presentation, we're going to have a Q&A. So please feel free to drop any questions throughout the presentation within the chat or the Q&A function, and we'll address these at the bottom, at the end of the presentation. Catherine and I will keep an eye on these. So next slide, please. So just to introduce you to everyone before we start, my name's Sam Rigby. I'm the Atos Clinical Educator for Tracheostomy and Respiratory Physiotherapist. Also, we've got Catherine Chappell with us, who's a specialist Atos head and neck nurse. And I'm very pleased to introduce Vanessa. Vanessa is a permanent tracheostomy user and has a wealth of experience in managing her own tracheostomy. So she's very kindly agreed to join us today to share some of her hints and tips with us about how she looks after her tracheostomy and stoma during the winter months. So thank you so much for joining us, Vanessa. Next slide, please. So the first thing we're just going to talk about is the impact of cold weather on lungs. So as the weather gets colder and winter begins to arrive, people with a tracheostomy might find that they experience certain things, but certain things like frequent bouts of coughing and experiencing an increase in production of mucus, and also struggling with sensitive or irritated airways. Now, why is this? Well, that's because the atmosphere during winter is a lot colder and the air's a lot drier, so it holds less moisture, which makes it harder to breathe. This dryness in this air can cause the mucus in our lungs to become quite thick, and also the dryness and the coldness can irritate the airways, which in itself causes the lungs to produce more mucus. So it's kind of like a vicious cycle that we get, and we can experience a lot more of a production of mucus during the winter months. That's why one of the things we'd recommend is if you have a HME or you wear HMEs, is that you wear that HME 24/7, because we've found from experience that the longer you wear your HME through the day, you get more of a benefit from it, and it helps to hydrate and helps to give back heat and moisture to your lungs. Next slide, please. So how does a HME work? Well, a HME stands for heat moisture exchangers. So we'll just recap how these work for you. A HME is a small device that fits on the end of the tracheostomy, and they're usually filled with a condenser element. Now, this can be any kind of material, but ours are foam for the ones from Atos that we provide. And what happens is, when you breathe out the heat and moisture from your lungs, rather than it being lost to the environment, the foam will capture this heat and moisture and hold on to it, so that when you breathe back in, you recycle that heat and moisture and you give it back to your lungs. And that's really handy because that heat and moisture is going to help to hydrate the mucus, so it keeps it nice and loose, so it's easy to maneuver and expectorate or cough out. And it also can help the lungs to regulate mucus better. So, you might find that potentially you'll have a reduction in your production of mucus as well. And there's several types of HMEs on the market to help you fit from your day-to-day life, and they have little handy features. So some of the HMEs we provide have a port, an opening to pass a suction catheter, so you can suction through them. Some have a connector, so you can connect oxygen. And others have the option for an integrated speaking valve, so you can actually have hands-free speech with an integrated function. So it just depends what suits you. So next slide, please. So we're going to ask you a couple of polls through this presentation just to get to know you guys better and just to see how you guys look after your tracheostomies at the moment. So the first question to ask is, what do you most commonly wear over your stoma? So we'll give you a couple of minutes to put your selection in and we'll have a look at the answers. So just choose your answer and then we'll see what those answers are in a second. Okay, so if we got, straight down the middle, 50-50, right? Interesting. So we've got 50% HMEs and 50% bibs. So yeah, that's really good to see. Okay, and we'll explore that a little bit more as we go through. So I'm just going to pass to Catherine now, if we move to the next slide, and she's going to talk a little bit about COVID and the flu season and a bit about stoma care as well.
Thanks, Sam. Hi, everyone. So we definitely know that winter's on its way, don't we? The clocks went back a few weeks ago. We've got the darker mornings and evenings, so winter is definitely on its way. And with winter, cold weather goes hand in hand with it. And unfortunately, in the cold weather, viruses do thrive. We tend to spend more times indoors during the winter also because of the cold weather, as well as spending time closer to friends and family, particularly around the holiday time. And all of this actually increases our chances of catching viruses such as influenza and COVID-19. Next slide, please. As a person with a tracheostomy, one way of protecting yourself further from catching these viruses at this time of year is to wear a HME. And this also has one with an electrostatic filter that filters viruses and bacteria and airborne particles in particular. For example, the Freevent Extra Care HME, which you can see on the screen, kind of in the middle of the screen. This is small in size, it's lightweight and it's comfortable to wear. As Sam said earlier, HMEs, this one warms and humidifies the air that you breathe in, creating that optimum humidity in your lungs and enabling them to function fully. It also protects you from the airborne particles, say, such as viruses, bacteria, dust and pollen. Because of the electrostatic filter, it also filters the air that you breathe in. It gives 99% protection against viruses and bacteria, which, as I mentioned on the last slide, the risk of this does increase during the winter months. Next slide, please. So another quick poll. So this time we'd like to find out if you frequently get chest infections, particularly at this time of year. So we'll give you a minute or two to answer that. Okay, if we can have a look at the answers. Okay, so it's almost 50-50 again, really. Majority of people, 56%, don't tend to get regular chest infections, but 44% of you do. So that's interesting to see. Hopefully, we can give you some advice on trying to reduce the risk of you getting chest infections. So another way of keeping yourself safe during the winter and protecting yourself from viruses is to ensure you're washing your hands regularly and remembering to wash them thoroughly for at least 20 seconds. So I think most of us have gotten used to carrying alcohol gel with us over the last 18 months or so when we go out and about. But by having it to hand, it allows you to clean your hands when you're out and about, particularly when you're not close to any hand washing facilities. And it's advised to use alcohol gel no more than 3 times consecutively in between washing your hands, basically. So use it for 3 times and then find some hand washing facilities if possible and wash your hands properly. The cold weather, along with frequent hand washing and the use of alcohol gel can dry our skin out on our hands, and it can cause irritation, soreness and cracks in the skin. So you might find by regularly moisturising your hands as well, that will help to keep your skin nice and moisturised and supple, and try and help reduce any outbreaks of soreness or irritation. Next slide, please. So not only does the cold weather dry the skin on your hands out, it can also dry the skin around your stoma and cause your stoma to become red or irritated due to the harsh weather. The exposure to cold weather can increase skin irritation such as your nose, lips and face as well. They become redder and drier. And excessive mucus can lead to excessive moisture around your stoma, which in turn can cause skin irritation. So by wearing a HME 24/7, as Sam mentioned earlier, this will help you to control your mucus production and to reduce it, also to reduce skin irritation caused by mucus. Next slide, please. So we've got some suggestions here for looking after your stoma, particularly during these winter months. By using barrier creams regularly around your stoma, this can help create a protective layer on the skin. Ensuring you're using a dressing under your tracheostomy as well. This helps to reduce any rubbing from the faceplate of the tracheostomy, rubbing on the skin of your neck. Also helps to absorb any mucus or any other discharge that might be leaking from your stoma, which could irritate your skin. If there are any issues with irritation of your skin, please speak to your healthcare professional, as you may be able to get an antibiotic ointment prescribed if appropriate. You can also ask your healthcare professional about other specialist dressings which are designed to promote healing and reduce irritation. Next slide, please. So it's poll time again. This time we're interested in finding out if you suffer with skin irritation around your stoma at this time of year. So again, I'll give you a couple of minutes to submit your answers. Okay, if we have a look at the answers, please. Okay, so majority, well, just over half of you don't suffer with skin irritation in the winter, so that's great. But 44% of you do, or sometimes do. So obviously that's not so great, but as I say, just giving you some tips on looking after your stoma. So hopefully if you can put some of those into practice, that might help reduce your risks or your chances of getting skin irritation around your stoma during this winter. So I'm going to hand it back over to Sam now for some more useful tips.
Thanks, Catherine. So one of the things that we obviously as well want to recommend is about staying active in winter. It's really important, obviously, as we've said, you know, the nights become earlier and they're colder, and it's that kind of temptation. I have it as well, where we want to stay inside where it's nice and cozy and warm, but it's still really important that we keep our activities levels up. And that's obviously, it's important from a physical health point of view, because, you know, generally keeping ourselves well and physically fit is important, but also from a mental health point of view as well. It's good to be out and about in the sunshine, interacting with people, still going about our day-to-day lives. It's really, really important for us. So we're not saying go out there and run a marathon. I certainly won't be. But what we are saying is just try and keep those kind of activities that you would usually do in your daily routines. So it might be walking to the shops or meeting a friend to go for a walk around the park, anything like that, where you're just getting out in the middle of the day. And it's about, I suppose, picking the time of day that you would go to. So middle of the day when it's nice and bright, picking your familiar routes as well, because, you know, it can get a bit cold and wet. So you want to know where you're going, but if you just pick those familiar routes and you're getting yourself out and about, it's really, really important to make sure we're doing that. So next slide, please. So just to talk as well about things that might indicate you're becoming unwell. So these are just some symptoms to look out for, which might mean you want to speak to your GP or to, look into them a little bit more. So general unwellness is something to obviously look for. So things like raised temperatures, fatigue, achy joints and muscles, that can be an indicator that you're becoming unwell. But particularly from a chest infection point of view, and particularly with people who have a tracheostomy, some of the other symptoms to look for are these as follows. So you might find you've got increased coughing. And as well, changes in sputum is something to look for. So this is really important. Sputum can tell us a whole story about our health. So if we're having an increased volume of sputum, if you're producing more sputum, that could be an indicator of a chest infection or something's not quite right. Consistency of sputum is also, or mucus that you're coughing up. When I say sputum, that's what I mean, is something to look for as well. So is it thicker? Because again, that could mean that, something again isn't right with maybe the cold air is affecting you, or maybe again you're overproducing mucus and it's getting really thick, and that's an indicator of chest infections. And as well, the colour of mucus and sputum, not the most attractive topic to talk about, but it can really, really indicate and tell us if something's going on. Because if the colour of your mucus that you're coughing up has changed and it's become, say, more green or yellow, or just any change in colour, that's again an indicator that potentially there might be a chest infection brewing, or you currently have a chest infection. Other things you might notice is more frequency of suctioning, because again, if you've got a chest infection, you produce more mucus, so you're needing to suction more. Or you might also find that you're changing your dressings more frequently, because again, the mucus you're producing is escaping through the stoma and is saturating the dressing. So the take-home message really is any change to your usual routine could be an indicator that something's going on. And also, you might find you're more breathless when performing usual activities. And again, if you've got a chest infection or you've got more mucus, or there's any irritation to the airways, then the airways might not be getting quite as much air into them each time you breathe as they would usually. So therefore, you find yourself, you're working a little bit harder to kind of meet the demands of your body. So if anything like this happens, what we would advise is you contact your GP to discuss this. Or obviously, if you have a named healthcare professional that you have regular contact with in the community, it might be a community track nurse or district nurses or someone like that. But usually the GP is the best point of call to go with for an assessment. And also little handy tricks and tips as well. If you've got really thick secretions, if you've got a nebulizer, use your nebulizer, because that's going to help to thin those secretions out. That the salty water that you breathe in through your nebulizer helps to hydrate the mucus, pull water into it and makes it thinner, so it's easier to cough up. So little tricks like that can help as well. Next slide, please. So what can your GP do for you? Well, as we've said, the GP is a great resource for improving your winter health, because they can provide assessment and treatment should you feel you're becoming unwell. They can also give you general advice on how to keep well at winter, much like we're doing now. They could probably give some extra advice on top of that, specific to you. Also, if you are interested in seeking a flu jab for extra protection, your GP can usually organise this, or at least signpost it. So if they don't provide it within practice, they can tell you where you can go for one. And things like a lot of pharmacy practices do it now, I believe, and even some supermarkets. So GP be really good for signposting you. And also another thing that you could potentially discuss with your GP is something called a rescue pack. Now, these aren't always offered, and I can't guarantee they're offered in every area. It can depend on things like funding, but I have known patients to have rescue packs before. And what these are is a lot of patients who have chronic lung conditions can get these, and it's usually a pack of antibiotics and steroids. And the idea of those is you don't need to have a chest infection to get these. The GP gives you a pack of them. So then if you feel you're becoming unwell, or you've shown signs of a chest infection, you can talk to your GP over the phone sometimes, or you can just start taking them. It depends on how the GP advises you. So the idea is you can start taking treatment sooner, so there's no delay, because obviously we know sometimes finding an appointment with a GP, then waiting for your prescription and picking that up, that can take a little bit of time. So it's always good to just discuss with your GP if you're concerned and see if they do offer some things like a rescue pack. I would say as well, though, if you do get a rescue pack, that's great. And if you do start taking it because you've got a suspected chest infection, brilliant, because there's no delay in treatment, but still seek an assessment from your GP, because you don't know, it could be something else going on. So it's always good to double check. But there are just another little handy tip that you could speak to your GP about. Next slide, please. So last poll for you here is we just want to know, where do you find support in the community? And there's multiple choices if you want as well, but we're just intrigued to see what the different areas what you guys have out there really supporting you. So we'll give you a couple of minutes to answer that. Okay, and then we'll check those answers in a second. Just let you finish off. Okay, so if we see if those answers are there, we'll have a look and see what everyone has. So yeah, quite a mixed mash, and it does depend on your area, doesn't it? I see a lot have GP, hospital clinicians, your point of call there for someone who looks after your tracheostomy, ATOS Care, so that's fantastic. If you're under our service, we're always here to support at customer care or nursing level, and family members. Let's not forget them; they're key, aren't they? So yeah, quite a mixture, which we would expect. Thank you very much. So next slide, please, and I think I'm passing back to Catherine on the next one, and she's just going to talk about some resources that are out there that can help you as well to support you.
Yeah, thanks, Sam. So before we move on to the next part of our webinar this afternoon, we've put together some resources which may help support you. If any of you are struggling or need extra support, please don't forget that, of course, you can contact your clinician at the hospital who can address any of your worries or concerns. And there are also several other resources and charities, such as the NHS Live and Healthy website. Sorry, Live Well Help website, the Swallows, Macmillan, Samaritans, Age UK, and Every Mind Matters. I'm sure there are many more as well. Next slide, please. And of course, as a customer of ATOS Care, you also have access to our customer care team and the nursing team. We're all on hand to answer any of your questions. You can also attend events like today as well, where you can get helpful hints and tips like Sam and myself have given you today. You can follow us on Facebook and Twitter and keep up to date with what we've got going on, what the latest things we've got going on. We can email these last two slides out to you after the event if everybody would like a copy of these, so you've got the references there. Next slide, please. And I'm going to open the floor now for questions. So just a reminder again, if you have any questions you'd like to ask Sam, Vanessa, myself, please enter them in the Q&A or the chat function, and we'll do our best to answer as many as possible. And to start, I believe, Sam, we've had some questions submitted prior to today's event, haven't we?
We have, yeah. So I mean, I'll take the first one, which is let's have a little look here. So I've got a question here, which is: sometimes I find the cold air catches my breath in the winter. How can I deal with this? So obviously, panel will discuss this. My first advice would be obviously HME usage is really important for that, because obviously that helps to warm and condition the air that you breathe in and can stop with that irritation, because that catching of the breath can be irritation. So sometimes HMEs, or at least some kind of covering like a bib, can reduce that. But obviously, anything that's going to help to humidify and heat the air as you breathe it in. But Vanessa, I don't know, have you got any, do you ever find that you catch your breath a little bit when the winter gets colder, and have you got any tips for that?
It can do sometimes. I think I tend to wear an HME, and then I wear one of these circular scarves.
Yeah.
This particular one's made by Buff.
All right.
I have a really skinny neck, and the child ones fit me really well, and they wash well, and you can breathe through them. And I think sometimes that keeps the wind away. I know some people struggle with covering their track because then they can't breathe. But sometimes I think it's about finding the right fabric.
Yeah. Definitely. And I think, like, I know some people do, like you say, opt, especially in winter, for the HME and the bib as well, which, just for the extra bit of coverage. I think we mentioned as well when we talked on the phone, Vanessa, if I'm right, a bit about hydration as well, and keeping well hydrated for things like, dry airways. And that's really important, isn't it? You say you find.
Yeah, I think, you have to drink a lot of water. And just generally try to keep everything hydrated. Personally, I use a nebulizer, I tend to use a nebulizer at night with saline,
Mhm.
probably about between 5 and 10 mils before I go to bed. And that seems to stop me drying out overnight, because one of the things I find more difficult than actually going outside is actually being indoors with the heating on.
Mm.
I find every time in September, November, I always have a few weeks when I struggle. And over time, I've realised it's the central heating.
Yeah.
So I
Yeah.
think it's not just the cold outside, it's the dry air indoors as
It
well.
is. Yeah, it's catch-22, isn't it? Both areas.
The other thing I do is I try to have a steamy shower every morning,
Nice.
because then you're trapped in an area with a lot of water and moisture in the air,
Hmm.
and that can help.
Yeah.
They're my three things: drinking water,
Yeah.
steamy showers, and using saline in a nebulizer.
Brilliant. Yeah, because I mean, that's it. One of the things is, if the more water we drink, the more water in our bodies, that water can be given to the mucus to help hydrate it as well. So that's kind of how that works, if anyone's wondering. But no, that's really, really good advice. I'll ask one more question, then I'll pass to Catherine. We just had a question come through from Jeff, which was just, since the weather's changed, my sputum's become a bit more foamy. So, I mean, foamy sputum, again, it can be just changes in sputum because of the way that the mucus is being regulated because of the cold, dry air. So again, any kind of the humidification products we've talked about might help with that, Jeff. Sometimes foamy sputum can be an indicator of something else. So it is always, if it's a change from your usual, it's always worth speaking to maybe your track nurse about and just getting them to check over that, or whoever looks after your tracheostomy. Just might be worth them having a little chat with you about it, but probably is due to that change in the weather. But yeah, definitely have a chat with someone if you notice any changes, like we said. I don't know if you've got any, would you agree with that, Catherine?
Definitely, yeah. Any changes is definitely worth reporting. But yeah, as you and Vanessa have both said, keeping hydrated. If you don't like cold drinks, warm drinks is just as good.
Yes. Mm. Lovely.
I tend to drink a lot of water with either with a drop of lemon juice, but often I'll drink boiled water rather than tea or coffee, because I find it easier to swallow.
Okay, so Gertrude has asked, sometimes the mucus cannot come out. My GP can't help me with anything. They send me to the hospital. So again, Gertrude, is just going back to what we were talking about. I don't know whether you wear a HME. So obviously Sam's gone through all the benefits and the reasons for wearing a HME if that's appropriate for you. That's something that you can speak to your hospital clinicians about if you don't already wear a HME. Vanessa's touched on nebulizing as well. Again, so I don't know whether you nebulize regularly. That can help to thin your mucus out, make it easier for you to cough it out. And again, keeping hydrated. These seem to be the common themes throughout so far already, don't they? So hopefully that's helped. Hopefully that helped.
The other thing is that it sometimes depends how long you've had your track. I think as you know, your body gets used to it and stops trying to reject it as a foreign body, then you get less mucus. I can remember when I first got my track, I was nebulizing 4 or 5 times a day. So I think it is something that you can gradually reduce over time. So for anyone who's an early track person, hasn't had their track very long, it does get better, I think, is the message.
Yeah, and I think Gertrude's just come through then, and I think she said it's mostly when she has a chest infection, which is understandable. It's when we produce more mucus. So yeah, like Catherine said, it's almost being proactive with it, and it's asking your GP about, can you get nebulizers? Can you get can you look at things like HMEs or any humidification devices to help with that mucus? And then obviously, another thing to mention from that is if we're producing more thicker mucus, if you've got things like inner cannulas in your tracheostomies, so that bit that comes out, making sure we're really on it with cleaning that and keeping that clear. If we're producing more mucus, you might just have to increase the amount of times you're cleaning that a day to keep that airway nice and open. So yeah, definitely just to mention that.
Yeah, and she's just said that she gets blood in her mucus sometimes as well. So again, that can happen with chest infections, and particularly if you're coughing more and you're coughing quite forcefully as well, that can cause a bit of blood. But again, as Sam mentioned earlier, if there's any changes in your mucus at all, please contact your GP or your hospital clinician for further advice. Don't just sit on it. There was another, I've just gone past the other one, I think. So Jeff has asked if there's something that men can wear that looks nice to hide the trachea while keeping the elements at bay. So obviously Sam spoke about the bib earlier, so wearing a HME and then a bib over the top to cover it or to give further protection from the elements. Vanessa wears a scarf, as you can see, but men, there's no reason why men can't wear a scarf as well. Obviously a nice, wrapped loosely around your neck. But there's no reason why you can't wear a scarf.
These types of ones you'll find in any sort of adventure type shop, or anywhere that sells waterproofs and things like that. They tend to be quite popular. But people who climb mountains and do all that strenuous stuff.
They're quite popular at the moment as well, aren't they, between men, from what I've seen. Rather than wearing face masks, they'll have these like snood scarves and they'll pull that up over their mouth.
Well, it does work. When you forget, you can just do this. But also, people think that they're masks, so I'm not so self-conscious about the fact that I'm wearing a scarf, and I don't worry so much about whether it coordinates or whatever. I think COVID has done us some favors, really. It's now okay to wear something around your neck. But I know lots of men who just wear a collar and tie. It does depend how much your track sticks out, what sort of profile it's got. If you join some of the groups on Facebook for tracheotomy users, then you'll get ideas from other people in similar situations. And you can usually find somebody else that's using the same tubes as you. I know there's a lot of people who knit their own bibs.
You're talented,
And there's lots of groups who make beaded trachea ties, so that the track looks more like a necklace.
Thanks, Vanessa, for that. Gwen says that she has brittle asthma and a trachea, and they clash in the winter. Sam, this might be one for you as our resident physio. Any advice to Gwen?
I mean, anything that kind of can trigger asthma, it's quite common too, especially with brittle asthma. It all comes from irritation of the airways. So anything that irritates the airways will trigger asthma or can trigger asthma. So obviously, as we mentioned, the cold air could be that trigger. So it's really being on top of your humidification. Bear in mind, if you think of it, when I'm breathing now, I breathe through my nose and I get lots of humidification and heat from my nasal cavity because I've got lots of blood vessels in there. When you've got a tracheostomy in, all that cold air is bypassing the nose. So it's going straight into the lungs and going to irritate that airway. So even like if I was to go out in the cold and I don't have asthma, sometimes I can feel a bit of irritation. So if you've got a tracheostomy in and you've got brittle asthma, it's being really on it with getting something like a HME if you can tolerate that. Speak to your healthcare provider about this, but that's going to help to heat the air up and stop that irritation, and really being on it with your inhaler or your nebulizers as well. So whichever your nebulizers are with your steroids or with your LABA/LAMAs or anything like that. Being really on it with that regime. And again, even kind of saline nebs, if you prescribe saline nebulizers, that can be a really good thing for hydrating the lung lining as well. So that can really help. But yeah, definitely I would say the brittle asthma is going to be triggered by that irritant of the cold air. So something that will warm that air up as you breathe it in will be really beneficial to you.
Yeah, going back to what you were saying about the rescue pack as well, Sam, that might be beneficial for somebody that's got brittle asthma.
Absolutely.
So it'd be worth Gwen speaking to her GP to see if that's something that's available.
I would absolutely. I'm just going to mention as well, I saw Mary dropped a little hint and tip in there, but I just want to add to that because it's a really good one. And just jumping back just to see where it was, but it was just around using nebulizers regularly, as Vanessa said as well, which is really good advice. And then obviously using a humidifier at night when the heating's turned on. So humidifiers are great, but not everyone, if you can't get your hands on one, sometimes we've recommended just when your radiator is in your room, a bowl of water near it, and that can actually give a bit of moisture and humidity to the air. So if know, if you need something at a pinch, then you can fill a bowl with water and pop that near your radiator, and that can help. So just to add that one in.
Lawrence is asking, how do you clean the inner cannula and how do you get suction when you need it?
I can talk a bit about inner cannulas. One tip that I found was that when you go and have your track changed, if you ask to keep the old inner cannula, you can actually build up a collection of them. And the easiest way to clean inner cannulas is to soak them. So to soak them in water and then clean them, and it comes off a lot easier. But you can only do that if you've got several spare ones. I know people cleaning them with pipe cleaners. So the sort of thick ones that you get from the art and craft shops. I think in this day and age, brushes are a bit difficult unless you've got the facilities to sterilise them, really. I don't think I'd be wanting to use a brush, you know,
Brushes can
sterilisation.
Yeah, brushes can scratch the inside, the plastic inside the inner cannula, and infection, you know, bacteria can breed in
you
those.
can actually do it with a tissue if you actually twist it through.
Swabs as well. So they look like lollipop sticks with a foam swab on the end that you can push down. We don't actually recommend soaking the inner cannulas. Don't leave them in soak. To actually wash them out and let them air dry, because if you leave them in soak, again the bacteria can breed in that water, which is why we don't really recommend that at the moment. But
but it's just quite hard sometimes to get it off if you just do it quickly, or maybe do it in a saline solution.
Definitely. As I say, those swabs, they're like a sponge, and they you can literally, it touches the sides of the the insides of the inner cannula, and that helps to wipe off any mucus that might be a bit stubborn. Regarding suction, so Lawrence, I don't know whether you've got a suction machine already, but suction catheters, your GP can either order them from NHS supply chain for you, or the GP can refer you to the local district nurse team who can order them, the suction catheters from NHS supply chain. It may be that in your area you have like a complex health care team where you have matrons or case managers, and they're responsible for ordering these items. So it's a case of finding out what the process is in your area, Lawrence. I think that's it about suction, really.
Yeah. Just speaking to your GP, isn't it, really? And just that's the best place to go.
And just going back to the inner cannulas as well, you should only use them for the length of time that the manufacturers stipulate. So if you have your whole, you know, if you've got have your whole tracheostomy tube changed every month, then you should change the rest, the other inner cannulas every month as well. Don't hang on to them because they can become brittle.
That's good advice. When I had my first trachea, it was quite hard to get inner cannulas, and I think you can get them separately now, can't you? You can order them if the consultant's willing.
Yeah. Depends on the manufacturer, depends on the brand of tube. Whether it's available on prescription or whether it's something that the hospital or the GP has to order for you. But yes, you can order spares. And there's usually a couple of spares that come in the box when you have your tube changed anyway.
Jeff's just mentioned about he has disposable. So some tracheostomies will come with just disposable that you kind of use once. The inner cannulas you use once and you get rid of, but some people will have reusable as well. So, and I think Vanessa really pointed out as well, if you've got reusables and you change it, you're cleaning it, make sure you've got another inner cannula in place whilst you're cleaning, because you should never have that. If any mucus was to get in there and you need to get rid of it quickly, that's kind of your safety mechanism. That's your quick get out. So never leave your trachea without an inner cannula, and for only for the time it takes to swap them over, basically, and that should be the maximum amount of time. So yeah, just to mention that. I've got a question here for Vanessa and Catherine, actually. I'd be interested to hear. So what options do I have if I don't want to wear a dressing?
Do you want to go first, Vanessa?
I think, again, that's something that you learn over time. I think when you initially get a track, you need to use a dressing because of the secretions. I personally now don't wear a dressing. I think, it depends on people. I think one of the things is you need to keep the skin dry. And if the dressing helps do that, then that's important. The only secretions I tend to have now are from my aspiration. So sometimes when I swallow, food and liquid go into my lungs and I tend to get a discharge. And I just wipe that away, but it's really a personal choice. And also it depends on your tube, if you've got a plastic tube or a metal tube or how it fits with your neck. And I think one of the things you do over time is you find something that works for your anatomy. And sometimes people need several dressings just to hold their track in the right place for their neck. So I think, they're things that you can experiment with. And they obviously come in all different thicknesses. You've got your standard tracheotomy dressing, and then you've got much thicker foam dressings.
Yeah, definitely. And not only have you got the thinner and the thicker dressings, you have bigger dressings and smaller dressings. So again, it, like Vanessa says, it depends on your anatomy, depends on the amount of mucus or other secretions, other discharge that you may have from your stoma. If you're wanting to wear a dressing, if it's because your skin's sore and irritated, then I definitely recommend a dressing, even if it's just for a week or two whilst your skin is healing. But you can also use barrier creams as well, so barrier wipes or barrier creams. Again, you can speak to your GP or your hospital clinician about which barrier cream might be more appropriate for you, but there are quite a few different ones available.
And I think Gertrude's just popped through and just said, just on the thing of dressings, I find that if I don't wear dressings, it increases my coughing. Is that usually after 8 years? I mean, you guys didn't put, but yeah, I would say so. I mean, one of the things to not forget about, depending on your tracheostomy type with dressings, is the tracheostomy has a face plate as well, and that can irritate and rub the skin. So the dressing stops that. So if you stopped wearing that and allow the irritation, any kind of irritation around the upper airway or the neck, that can stimulate coughing. It's like having a sore throat as well, and that can cause you to cough. It doesn't have to be specifically down in the lungs. It can still be around the stoma site that can trigger coughing as well. So yeah, that's absolutely normal.
I think also that like I said, the dressing helps position the trachea in the place that's most comfortable for your neck. And if the tube sits better a little bit forward, then that dressing will maybe actually prevent you coughing, because sometimes the cough's triggered by the bottom of the tube.
Yeah, that's a really good point, actually, Vanessa. Yeah, it's about tube positioning, isn't it? So can, again, because it's a piece of plastic or metal, isn't it, in your neck? So it still will, if it knocks around, it will irritate. Let's not forget that. So it does the job great that it needs to, but yeah, it's all about fixing it in place. I suppose that's why things like trache tires as well are really important. But it's all about daily care, would you say, guys? It's all about daily care, isn't it? Making sure you've got a nice regimented routine to manage all of this stuff. Yeah.
Just generally keeping clean. I mean, one of the things you learn when you first get a track is you learn to wash your hands all the time. Well, now the whole population's doing that. So in some ways, it's about keeping clean. I personally, one of the things in this country is we have to get saline on prescription, which is a real pain. So you can't just, buy a bottle of saline to use. But I personally feel that saline, it's a really old-fashioned remedy, as like just salt water. And it really does help keep the bacteria levels down. So from my personal experience, I'd recommend that.
Fabulous.
Yeah, sometimes the old remedies are some of the better ones, aren't they? And saline nebulizers, while some people don't want to nebulize, several times a day, every day, and that's absolutely fine if they can manage their their mucus levels and cough the mucus out fine. But when it starts getting thicker and stickier, particularly at this time of year because of the cold, then, you know, they do have a place then, don't they?
Yeah, I mean, I flew to Gran Canaria last month, and the sudden change of weather really affected me to the point that my speaking valve was sticking and I couldn't work out why. And I realised it was just because my mucus had thickened over the flight and in the couple of days when I arrived.
And then Jeff's popped in the chat here just about he's moving to a silicon trachea because the one he now has is caused granulation, so it's blocked 2 to 3 times, and the granulation leaves in breathless. So again, I think that Jeff that's great that you're getting that sorted, and it's about finding the right tracheostomy for you. But I think any just hammers back to that thing. If any symptoms or any changes to your kind of usual routine, communicate that to your clinician as soon as, really, so they can review that, because then obviously a granulation can be a serious issue. So it's good that they picked that up and they're rectifying that. So yeah, it's a really good point.
And I think, you know, he's going back to your consultant because often granulation is caused by friction. So it's when your tube's moving more than it needs to. I use a very small cannula now that just sits just inside my neck, and that doesn't move at all, and it means you get rid of a lot of those extra irritation. So you need to think about how tight your ties are, and just generally try, you know, if you're going to really cough, hang on to your tube first, because you don't want it bouncing around. It's better if you can just hold it still, because it's all that friction that causes granulation and extra mucus.
Really good point. Actually, yeah, I never even thought to say that myself when advising, but yeah, hold on to it when you're coughing. It's a really, really basic but good point.
Because otherwise it's making more and more movement.
Yeah, exactly. And I think what I would say as well is, you know, there's an abundance of tube types and sizes and lengths, and obviously, you know, it's just having that conversation. But people may need longer, some may need shorter. It just depends on obviously the reason for your tracheostomy. So be guided by your clinician, but like you say, Vanessa, have that open conversation with them about what's going on, so you can, you know, select the best one. But
I think in the UK we have to remind our consultants that one tracheotomy tube doesn't fit everyone.
No.
You know, that we're all different. I've got a tiny neck.
Yeah.
You know, other people have big necks, some people have wide tracheas, some have narrow.
Yeah.
And sometimes it's just about the angle. And that's all we were saying earlier about dressings can help you get the right angle so the tube's not irritating. I mean, the ideal solution is that you can't feel your tube at all. And, you know, that's what we aim for. So if your tube's uncomfortable, go back and get them to try you with different tubes.
There you go.
Hopefully your new tube, Jeff, will sort you out. I think we have got another question that came in before. The cold air at night can wake me up with coughing. What can I do to reduce this? Again, I think it goes back to what we've been talking about quite a bit throughout the presentation, and with the tips and tricks that we've given during our answers. Wearing a HME, as Sam was talking about before, warms and moistens the air that you're breathing. It helps to loosen and keep the mucus thin and more manageable. Helps to reduce coughing. You can wear a bib over the top if you wish. Again, heating overnight, that will dry the air out as well. So again, HME, keeping hydrated. Guys, help me out.
Yeah,
If you're wearing a bib, you can actually use the saline spray to spray it to make it moister.
That's it. We obviously don't over moist it too much, I suppose, is the take home with that, because because people don't go dunking it.
Yeah, well, you won't breathe too well then, but yeah, it does help.
It's out of the breather, but no, that's it, exactly. And you know, because I mean, I don't think there's anything worse than not getting a good night's sleep, and I think that's one of the major things at winter really is coughing. But what do you, just remind me, Vanessa, do you use your HME day and night? Because you mentioned
I use a bib at night.
Use a bib at night. Okay.
That works quite well for me. I don't have a tube that fits the standard HME, otherwise I would use an HME.
Yeah.
But I use the small little navy bibs, and they sit really well
Mhm.
on my shape of neck.
Yeah.
So again, it's finding out what suits you.
That's it.
And it's for me, it's the nebulizing at night and the shower in the morning.
Because I think for a bib to work really well, you have to have a nice tight snug fit, so it's got to be a good fit to you. And sometimes if you're rolling around at night, they can come loose and things, so it's just
Yeah.
finding what's right for you, isn't it? Exactly that. Really
Yeah,
good
I
advice.
mean, with the cannula that I use, I can't use an HME, but if you can, it's always worth trying, and it's worth trying the different ones so you get a resistance that's good for you,
Absolutely.
because we know that resistance keeps our lungs healthy.
It does exactly. Yeah, very good point. It does. That bit of back resistance helps with that lung function a little bit better, doesn't it? But no, I think, like you say, Vanessa, like in your case, it's better to have something than nothing, isn't it? Obviously you've got the option to HME at night, but that's why it's still really good that you're really proactive and using that bib at night time, isn't it? To give you that some degree of warming and moisture. So that's good. Yeah.
Just one last question. Again, this has been spoken about throughout, but my stoma can become quite red and inflamed at winter. What can help to improve this? So again, it's going, like Vanessa said, good hand hygiene, good stoma hygiene, keeping your stoma clean, wearing a dressing can help, or barrier creams can help as well. Anything else to add to that, Sam?
No, I think you're completely right. You've covered it all. It's like those speaking to your nurse or whoever looks after it to talk about those specialist ointments or dressings as well that can help with healing, because we just find there's that inflammation at winter. Yeah.
Okay, I don't know whether there's no more questions have come through.
One more has just come through to me. It's a bit of it came through on an email, so I don't know if anyone's ever heard anything like this, but it's someone's just reported that they get regular discomfort and stiffness in the neck at winter. Now I'm trying to think myself in my brain, really. I wouldn't say if that's anything directly related to the tracheostomy. It might be more cold weather and joints at that. Yeah, but I mean, again, anything that's kind of straight new or different or anything like that, I would consult your GP and get them to look into it. Yeah.
Maybe think about wearing a scarf as well when you
it's really good advice
around your neck when you go out and about. Okay, this might be a good time just to remind everybody, or to let everybody know that if you need any supplies over the Christmas period, the last order date is the 8th of December to guarantee you delivery by Christmas. So just to make you aware of that, anything placed after the 8th of December may not arrive before the Christmas period. We also have a Christmas event on the 14th of December. So look out in your texts and your emails and for your invite, and we'll hope to see you there as well. And I've just seen Hannah's put the link to it in the chat. It looks like Harry is going to be singing some carols with us. Harry's a laryngectomy, and he actually joined a clinician webinar that a couple of our colleagues did a couple of weeks ago, and he was really good. I think he played, was it a ukulele, Sam, that he plays? Did you see that one?
I missed that one, but I was out traveling, but I heard it was very, very good though. It got really, really good reviews. A guitar. There you go.
Thanks, Hannah.
Shows we're not very musical, that, doesn't it, Catherine?
Anyway.
Yeah.
And just while we're waiting to see if there's any more questions coming through, also when the webinar ends this afternoon, there'll be a short survey just pops up on the screen. It's just the way we can get your thoughts and suggestions for future events, ways for us to improve, and also for topics that you might suggest. So if you wouldn't mind completing that at the end, please, that would be very helpful for future events. We'll just give it another minute, I think, and then we'll.
Just a big thank you to Vanessa as well for joining us today. I know it's really nice of you to take the time out of your day, and it's always great insights you give us. So it's really, really valuable, and I know everyone really appreciates those insights that you give. So thank you so much for joining us.
Thank you. I think it's just remembering that everyone's different.
Yeah.
And that there is support out there on Facebook groups if people are looking to get in touch with more people with drags. If you just search tracheotomy, you'll get a choice of groups, some of which I'm involved in, so you can look out for my name. All right, then, take care. Bye.
Oh, thanks, Vanessa.
Thanks, Vanessa. I think that's it. There's no more questions come through, is there? Oh, Gertrude says she'd like to join on Facebook. So I think it's Tracheostomy UK, isn't it, Vanessa? The one
Yes,
that
it
you're
is,
involved
yeah.
in. So if you just put that into the search box on Facebook, Gertrude, that should pop up.
Oh, there you go. Hannah's popped it into the
Thanks, Anna.
into the chat. She's on it.
Okay. You're welcome, Gertrude. Okay, I think that's about wraps us up, doesn't it? So again, huge thank you to Vanessa for joining us. It's always great to actually hear it from somebody that does have a tracheostomy.
Can I just say that's the wrong link? That's the link for parents with children with tracheotomies. All right, so try another Tracheostomy UK and you'll see me as the admin. All right.
I know. Thank you, Mary and Jeff, as well. Thank you.
Yeah, thanks to everybody that submitted the questions as well. Keeping the chat going for us. And we'll hope to see you on the Christmas event next month on the 14th.
Yes.
I will be all there. Take care.
Take care, everyone.
Okay.
Bye.
Bye, everyone. Thank
Bye.
you.